As this month comes to an end, hopefully volunteering for hospitals won't. National Volunteer Month runs through April and highlights the work volunteers bring to the community, like providing extra services to staff so they can focus on patients. And joining me now is Reverend Mike Guthrie. He is the Director of Spiritual Care, Clinical Ethics, and Volunteer Services at Presbyterian-St. Luke's Medical Center. Thanks for joining us on the show today.
Yeah, absolutely. Thank you so much for inviting me and giving me a chance to speak about and highlight our volunteers.
Yeah, let's talk about that. How do volunteers help hospital staff?
So, one of the core values of our hospital is care like family. And our volunteers very much are a part of the family culture within the hospital. And so they do two things. They help support our patients and they help support our staff. We have a motto, which is that our volunteers brighten patients' days and lighten staff's load. And so there are some very specific things that they do throughout the hospital.
Yeah, that's great. Do you have to have medical training in order to volunteer at a hospital?
No, not at all. Our volunteers go through an onboarding process very similar to how we onboard employees. And then in the particular areas that they get placed, they go through several stages of training and orientation. And then they begin to cover their own shifts. So we have volunteers in our neonatal intensive care unit that cuddle babies. And so they get trained specifically by both seasoned cuddlers and staff on the appropriateness and ways of cuddling babies. And then we have volunteers at our front desk that greet patients coming in and provide wayfinding and help reduce some of the anxiety as they come into the hospital. And then on nursing units as well. But we don't require medical training.
Well, it's such important work. And, we've done stories on the shortage with medical professionals right now. How great is that need for volunteers to step up and contribute?
It's a significant need. I think for us, we average about 5 to 6 what we call FTEs, full-time equivalent hours that basically our volunteers, the amount of hours that they do throughout the hospital equals to about 5 employees. And they do everything from helping stock rooms to helping prepare rooms for new patients coming in. They also do what we call comfort rounds, where they go to patients' rooms and provide blankets and water. And then they do a lot of support for our staff as well. And so they help really lighten that load and that burden that our nurses have so that those nurses can really focus on their clinical work. And then those volunteers help support them in that way. So.
Okay, so for people interested, how can someone sign up to volunteer?
Yeah, absolutely. Our website, it's pslmc.com. There's a tab that says About Us, and you can then scroll down and click on volunteering. Any one of the Health One hospitals across the Denver metro area have the same link. And so if our hospital isn't close enough to you, several of our sister hospitals may be in your community where you can come and help support our staff and brighten patients' days.
Yes. All right. Thank you so much for all this information and coming on the show. And
absolutely.
Remember,
thank you.
Yes. Have a great day. And remember, you can watch all of our health interviews right now on cbscolorado.com.